As we mentioned in the introduction video, it is important to remember that as a patient, you have rights and responsibilities, which may include asking questions or refusing treatment for you or your baby. Consent is required before any procedures or tests are undertaken. To help you understand the informed consent process, we use the BRAIN framework. BRAIN stands for benefit, risk, alternatives, intuition, and nothing or now. Benefits. What are the potential benefits to me or my baby of this procedure, care, or medication? Risk. What are the potential risks to me or my baby of this procedure, care, or medication? Alternatives. Are there any alternatives to this procedure, care, or medication? These may be medical, surgical, or alternative forms of care. Intuition. What does my intuition or instinct tell me about this decision? Nothing or now. What happens if I do nothing? Or does this need to happen right now? When using this framework, you may find that you need more information. We encourage you to discuss any questions with us, and we encourage you to take some time to make any decisions. Working through this process can also help highlight some of the potential outcomes of the decisions you make. You should have already discussed your birth plan and pain relief options with your doctor or midwife, and having your baby at the Women's Book should provide you with most of the information you need. Please feel free to keep asking the doctor or midwife any questions you wish throughout your labour and birth. Our staff are there to help and guide you. Now let's have a look at medical options for pain relief. We've already looked at non-medical ways to reduce adrenaline, stress, anxiety, fear, and pain in labour. For some women, stronger pain relief options are required. At the Women's, our medical pain management options include transcutaneous electrical nerve stimulation, otherwise known as TENS. TENS is a small, portable machine that potentially relieves lower back and contraction pain. The machine needs to be hired or bought before use, so you would need to bring it with you to the hospital. It emits small electrical signals into the body via electrodes placed on the back, providing both a distraction and helping to block pain messages from reaching the brain. It is most beneficial during the first stage of labour. It works really well if used early in the labour, and it can be used at home. As different people have different ideas as to what they consider an advantage or not, we've listed the average responses about advantages and disadvantages to pain relief options. Your ideas may be different to those I'm about to list. The potential benefits of the TENS machine. It can be used with other methods of pain relief. It can be used in any stage of labour. It helps to increase endorphins. It is controlled by the woman. There are no pharmacological drugs involved, therefore it has no medical effect on the mother or the baby. And the woman can move about as desired. It can also be used for long periods of time, and it is effective for pelvic and back pain. The pulses emitted by the TENS machine can be increased in strength and frequency as desired. Now the potential disadvantages or risks. It needs to be purchased or hired. It can't be used in water. It may not be strong enough. And it may take about 10 to 15 minutes to start reducing the pain. Now let's have a look at sterile water injections. Sterile water injections can be used if you experience a lot of back pain in labour, or if your baby is in the posterior position, where the baby's back is against your back, potentially causing more back pain. Tiny amounts of water are injected just under the surface of the skin to 4 sites on the lower back, forming little pockets of water. This can offer relief by blocking pain messages from reaching the brain and releasing endorphins. The potential benefits. It decreases back pain. It works very quickly. Back pain relief may last up to 4 hours, and it can be repeated as often as necessary during labour. It enhances endorphin production. There are no drugs involved. It can be given by a midwife, and it can be used with other forms of pain relief. The woman can continue to move about as desired. Now the potential disadvantages or risks. For some women, it may not be strong enough. It can produce a bee-like sting when it's given that lasts up to 1 minute. Heat or massage are not recommended as it can decrease the effectiveness. It may not completely take the pain away. Now let's have a look at gas. The gas is a mixture of nitrous oxide and oxygen, often called laughing gas or Entonox. The birthing woman inhales the gas through a mouthpiece during a contraction using regular, deep breaths. The gas is eliminated via the lungs, so the effect is temporary. Its purpose is to reduce the sharp peak of pain during a contraction. It is most beneficial during the first stage of labour. The potential benefits of using the gas. It enters your bloodstream quickly and does not accumulate in the mother or the placenta. It can be discontinued easily. We have it available in our birthing rooms and in the bathrooms. It can be used with other forms of pain relief. It doesn't interfere with good birth hormones. It can be used for long periods of time. The woman can remain upright and move about. There are no known side effects on the baby. Now some potential disadvantages or risks. It may not be strong enough. It may cause some women to feel dizzy or nauseous. It is not recommended in some medical circumstances. Let's have a look at morphine. Morphine is a drug that provides strong pain relief. It helps birthing women who are tired to rest, or birthing women who are tense to relax. It is usually given by injection into the thigh or bottom. It may take up to 20 minutes to provide pain relief. It is most beneficial when given during the first stage of labour. As morphine is a strong drug that can affect the baby, a vaginal examination is recommended prior to having the injection. This can help to estimate the baby's time of birth. Morphine tends to have the greatest impact on the baby about 1 to 2 hours after it's given. It can affect the baby's breathing and also their ability to have their first breastfeed. Because of these things, no more than 2 doses will be given during labour. The potential benefits of morphine. It is a very strong drug. It may be effective for 1 to 4 hours. It can provide the woman with an opportunity to rest and relax. There is no increased risk of a vacuum or a forceps birth. Usually the woman is not restricted to the bed. It can be used with other forms of pain relief. And now some potential disadvantages or risks. Morphine does cross the placenta and may affect the baby. It stays in the mum and baby system for up to 18 hours, potentially affecting breastfeeding. It does reduce endorphin production. Depending on when it's given, baby may require assistance with breathing at birth. It may not be strong enough for some women. It cannot be quickly discontinued once it's been given. It may make some women feel disorientated, and you may be unable to use the bath for labour or birth. Nausea is a common side effect. Now let's have a look at epidurals. In maternity care, epidurals are used to potentially remove pain sensations from approximately the waist down to the toes. An anaesthetist administers an epidural. The drug is passed via a needle and fine tubing into the epidural space in the spine. The procedure may take 10 to 20 minutes to perform. An intravenous drip is required for fluids and/or drugs. The drugs are delivered via a computer pump that the birthing woman is able to control. The drug may take another 15 to 25 minutes to be effective. The drugs commonly used are local anaesthetic and opioids or narcotics such as fentanyl. Because of the length of the procedure and the drugs used, a vaginal examination is recommended prior to having an epidural to estimate the time of birth. A catheter is inserted into the urethra to keep the bladder empty. Continuous electronic fetal monitoring is recommended to monitor contractions and the baby's well-being if you choose to have an epidural. Once the epidural is removed or turned off, the return of full physical sensation takes between 30 minutes and 3 hours. So let's look at some of the potential benefits. Total pain relief is achieved about 80% of the time. An epidural does allow a woman to rest. An anaesthetic doctor performs the epidural. Major side effects such as infection, nerve damage, and drug reactions are extremely rare. It may be beneficial for women birthing multiple babies. Now let's look at some potential disadvantages or risks. If used in early labour, epidurals may reduce the production of oxytocin, slowing the labour down. Vacuum or forceps for birth may be more common. Newborn feeding instincts may be inhibited or delayed in the first 4 hours, which may impact on the breastfeeding journey. Endorphin production is markedly reduced. Minor side effects may include shivering, a fever, itching, lowering of blood pressure, and back pain. A woman does need to stay in bed. It often takes 20 to 40 minutes to take full effect. The urge to push sensation is usually absent, which therefore makes second stage of labour longer. You can find more information about epidurals on our website.